Welcome back. And here with me from CHI Health, I have Jody Hayes and Kathy Tremmel. Thank you so much for joining me today, ladies. You're here, we're going to be talking about the SANE program at CHI Health. So let's start with you, Jody. You're the SANE supervisor. What exactly is the SANE program?
The SANE program is a sexual assault nurse examiner program. It provides services to victims of domestic violence, sexual assault, and human trafficking at all of our local area hospitals.
And again, just talking about both men and women, like you said, it's not gender specific when we talked earlier before the show. But what makes CHI's SANE program different from others in the Omaha area?
Our CHI hospitals are spread throughout the city, and then we also have CHI Mercy in Council Bluffs. So you're really able to go to an emergency department or a hospital within your community, close to where you live, which is a huge comfort, especially to our victims.
Sure. And what exactly is a SANE nurse?
So a SANE nurse is a registered nurse that has undergone specialized training in forensics to conduct examinations, document injuries, photograph those injuries, provide that trauma-informed, patient-centered care that the patient needs when they come to us during that traumatic event.
And is that what you are, Kathy?
Correct.
Okay. And then let's talk a little bit about the components of the exam. You know, whatever it's bringing them to there is traumatic itself. But this is also something that, you know, you have to take a lot of care. So what exactly are the components to that exam?
Well, for me, I understand that it's very hard for patients to come forward and report the assault. They fear that they're not going to be believed, that they're going to be blamed, that they're going to be judged for what they did prior to the event. So I always like to thank my patients for coming and for coming in and for coming forward and opening up to me about the exam. Also, I think it's important that our locations, we have designated rooms, designated areas that provide comfort, privacy, security, where we can conduct the exam, make them feel comfortable, make them feel safe, let them know that they're trusted and that we're going to take care of all of their needs. So it's very important that at all of our locations that we have that for them. And then we just, you know, every trauma, every patient is completely different, so we just have to let them guide the process, and we give them what they need and what they want, and we make sure that they have all of those needs met before they leave.
Is there, like, how long does an exam typically take?
There isn't a real time frame that we can place. It's just based on the injury, the trauma, what the patient needs. We do call in advocates. They come in and provide support and education. It's basically what the patient needs. And
so one of the topic points that I want to ask is, why is a space designated specifically for the SANE program?
Privacy and comfort.
Maintain dignity, for the most part.
And I know we were talking just out front before we got on camera, just kind of how many folks came to see you last year versus this year, and you're just seeing the numbers kind of rising. First, I think because you're now doing this.
Correct.
And do you have any other thoughts about those numbers?
So our numbers have increased 50% over the last year, from 2017 to at our numbers currently. I think it's more due to awareness. Not just within our CHI Health program, but nationally and citywide as well. When more people recognize that there's help and resources for them, they're more willing to seek assistance in these times of need.
For sure. And let's just talk before we wrap up, what is the Survivors Bill of Rights 2016, and what is the state of Nebraska doing to support the SANE program?
So the Survivors Bill of Rights basically has made it so any victim of sexual assault can receive a medical exam and not be charged for that exam as it relates to the sexual assault itself. The state of Nebraska has made great strides over the last couple of years. There's a law in place where they hired a state forensic nurse to oversee all of the SANE programs across the state of Nebraska and to build protocols and maintain competency across the entire state. There's also been the payment program that has been produced through the legislature that reimburses hospitals that provide these exams for patients. And we have also passed legislation to help victims of human trafficking, and to also decrease or revamp our mandatory reporting laws for sexual assaults.
I mean, such important work that this program is and that you ladies are doing. So I just want to thank you. Just thank you so much. How can people find out more about this? Is there a website?
There is education on
Yep.
the CHI Health website. We partner with the Women's Center for Advancement and
Okay.
Heartland Family Services. That is our advocate for the different communities that we service. And they all have websites as well.
And I guess before we leave, just as viewers are watching, do you take donations? How can people help? Is there a way that they can financially donate to support this program?
If they would like to, they can contact the CHI Health Foundation.
Okay.
We are always willing to accept donations.
Sure, absolutely.
For sustainability for our program.
Yeah.
And different needs that we have throughout.
Okay, wonderful. Well, I just again want to thank you both so much for coming. And again, that website one last time.
It's CHI Health.
Okay. And I just want to thank you, and we will be right back.